headquarters of common sense.
Talk Radio.
Let's talk to the medical director of the Rutherford Cancer Centres, Professor Karol Sikora. Good evening, Karol.
Good evening, Kevin.
This is a victory for common sense. Thank God the Health Secretary has done the right thing.
How could it get to this point to do it? 2 days before the event was cancelled. I mean, the amount of paperwork I've had to go through personally over the last few weeks because of it. We have NHS contracts in our centres. One's in Wales. And in Wales, they didn't have mandatory...
Of course, yeah.
I mean, it's just ridiculous having this separatism, you know. So Wales could recruit all the people that didn't want a vaccine from Bristol, for example. They just go over the bridge. And it is just a farce, the way it's going on. And I have to say, it's really disappointing. I really liked the way Steve James, the anaesthetist at King's, which we all remember seeing his interview with Sajid, he was so cool about it. He just rationally explained why the vaccine was not to reduce the infectivity of the virus. It would reduce the severity of the infection to an individual, but not do what the NHS need to sort of get rid of the virus. So it's a leaky vaccine, unlike hepatitis. So I could go on all evening, Kevin. I won't bore you.
No, I mean, I've heard all the arguments. I mean, the vaccine is certainly not the be-all and end-all when it comes to stopping the virus and stopping the spread of the virus, or certainly us not getting the virus due to having had the vaccine. So there are all sorts of arguments against. And Steve James's argument was that he'd had it, he had antibodies, he was willing to test every day, and that really comes down to the question that has to be asked of the health secretaries. Why did you feel, Sajid, that it was right, either morally or legally, to force people into having the vaccine, or they lost their jobs, you know, to coerce them with the threat of being fired unless they had the vaccination? And, you know, I spoke to several people who worked for the NHS for 30 years, were facing losing their jobs for this. So the question to you, Karol, is that why do you think the Health Secretary, and indeed by extension the Prime Minister and the government, felt that these coercive tactics were justified?
I think, you know, they felt that. The excuse is that Omicron's changed it all and somehow it's weakened the severity of illness, therefore we don't need to do it. That's clearly not the case. The worry was to lose 80,000 people from the system. And everybody is pretty important in the system. It doesn't matter what you do, whether you're a healthcare assistant, a cook, a porter. If you're not there, things don't happen. And I think that's the problem. And I would imagine the professional distribution of people that refuse vaccines is very much skewed to the lower end of the pyramid. Very few doctors, apart from Steve James.
Of course.
And some of my colleagues that I've had to sit down with for an hour each to try and persuade them, because we were going to have to not let them work with us. So this is just craziness. The amount of time NHS administrators have spent on this, completely wasted. They could have been doing much better things about clearing the backlog all around the system. And that's why it's so crazy.
My suspicion, I'm sure it's yours as well, is that what Sajid Javid wanted to do was to keep the gun at everyone's head right up to the last moment, in the hope that right at the deadline, i.e. round about now, the 80,000 or vast numbers of them will go, right, I folded my I stacked my cards, I don't want to lose my job, I'll get the vaccine. But it's been pretty clear for several weeks, if you ask me, that those who already hadn't had the vaccine were not going to change their minds. So I'm not sure quite why the Health Secretary sort of dug his heels in so stubbornly and caused all the problems you're talking about. He should have known they weren't going to get the vaccine.
I think senior managers in the NHS and the politicians are totally out of touch with the reality. And I've seen this with our staff. There's no doubt there are a few that are committed. They don't want to have vaccines. They're tremendous employees, but they just don't want to be vaccinated, whatever the reason, whether it's religion, whether it's a risk of side effects, which there are, of course, whatever it is, they don't want it. So you try and persuade them, but if they won't do it, they won't do it. And as you say, 80,000 people haven't done it. And maybe a few thousand converted because of the threat, because they need the money, they need to pay the mortgage. But many people have got real principles about this. So let's respect each other. Let's respect the principles. The workforce is very precious. And to screw up your relationship with the workforce for the health secretary is political suicide in the long term, which I think will happen. I mean, it's not going to work.
This isn't really your area, Karol, but of course, I think it was 60,000 care home staff lost their jobs. And they're saying that the necessity for care home workers to be mandatorily jabbed now is also going to be lifted. So can common sense prevail there? And can the people who've lost their jobs get their jobs back? Because I know for a fact this is resulting in the more medically problematic care home residents, because there aren't enough staff to look after them, are having to be transferred to hospital. So it would be good to bring the care home staff back into the fold as well, wouldn't it?
They must do. These people are absolutely precious in society. It's a job that not many want to do. Many of them are committed, they're caring, they're kind, they're empathic with the elderly patients in care homes who are often severely disabled and severely confused with dementia. And, you know, who's going to look after them if the care home staff go? We've got to have a rational way of going forward. Omicron and COVID is not a big deal now. Sure, it's killed people, but we are moving forward in a very different world. The numbers are going down, the hospitalizations are going down, the ventilation's going down, and the deaths are going down. We've got to be much more rational about this and get away from the fear that this has caused. And care home staff, equal importance to NHS. They are part of the same care system. And between them, the NHS and care homes have nearly 2 million people employed in the system. That's the biggest employer other than the Chinese army, I guess. That's the illiterate we always use, but maybe the Russian army now as well.
Listen, Karol, I'm really glad that you're not going to lose those 80,000 staff, and I hope that the government in the future are never this authoritarian again about such matters. In the end, everybody has got the right to refuse the vaccine for whatever reason, if that's what they decide, and we shouldn't coerce them otherwise. Karol, always a pleasure to speak to you.
Good talk. Hot talk.
Bold talk. Talk radio.
Listen on your smart speaker.
Watch it live on your smart TV.
The world headquarters of common sense.
Talk Radio.